In this session, I'm joined by Mike Von Fraunhofer, close friend of mine and also a medical doctor. And we're going to look at the legitimacy of sharing your faith in a medical context in a way that respects both patients and codes of conduct. One of the conversations that's going on much more in medical world nowadays is this concept of holistic care.
Yeah, well-being. Yeah,
probably much more so than when you and I went through medical school, when it was far more definitely physical, a bit psychological, very little reference to overall well-being, and certainly not the spiritual care. No, and I think now that that need, and if you like, and a good need, and also requirements within our regulations of taking a person's whole well-being into consideration in their provision of healthcare is actually really important nowadays, isn't it?
Yeah. And to be honest, I was really surprised because only not that long ago I've discovered that the GMC, which is the governing body for the UK medics, has actually got a supplementary document about spirituality, and in it they actually say it's a must. They say that doctors must take into account not only their physical and psychological elements, but they must consider their spiritual and cultural elements. And so it's not a you could or you might, it's a GMC must. You must do it.
Yeah, I think overall, if people have got belief systems, they're an important part of how they operate.
Yeah.
Their thought processes, their values in life are affected by such things. And there's a lot of research that's been done across the globe which shows that people with religious beliefs actually enjoy better health.
They do.
And better health outcomes and actually a longevity of life compared to those without religious beliefs. And that's not one particular religious belief, it's any religious belief as far as I can see. So it's almost negligent not to take it into account with people, isn't it?
Yeah, and also there's this divide. I think a lot of my colleagues, non-faith-based colleagues, would feel it's all about the science. Their job is to present the science about this treatment or that treatment or whatever. But the thing is that actually 60% of the UK population believes in some form of God. And then I was astonished, 25% of the population believes in angels, and 1 in 6 believe in miracles.
Yeah.
And so it's almost like I've got a cartoon I sometimes show of a dog barking at a cat meowing, So you've got the doctor sitting there talking about science, statistic, probabilities, and all that kind of thing. And the patient's thinking miracles and angels. Yeah. And we've got to include their beliefs in what we do.
Well, I think one of the challenges is the perceived incompatibility of Christian faith and science, and it's something I've thought about a lot. It could be other faiths, but people seem to think that they are separate. And I think one of the questions I've been asked more than any in my medical career and Christian careers is, wow, you do those two things. How do you do that? As if they're like oil and water, they've never mixed. And but in my mind, even right back when I was 16, I never had an incompatibility in my mind. So I thought about that quite a lot, and I describe it like this, that science really is the discovery of things that already exist, and then the application of that knowledge into everyday life. So science isn't creating new things, it discovers what already exists.
That's done, yeah.
And so and there's a lot of hypothesis within science, and we think this will work. So even science doesn't always start just with the facts. It starts with a lot of ideas and a belief that maybe there's this subatomic particle. Let's see if we can find it. So the advance of science is not based on what we already know. It's actually trying to find out what is out there to discover. And I say that if science isn't moving forward, it just becomes a history. But the frontiers of medicine are being pushed out because people believe there are new antibiotics to be discovered. There's new ways of treating cancer. That it often starts in a hope and a belief system, and then that follows through. And I say that Christianity is basically the belief that God exists, and if He exists, who is He? What's He like? And what way does He want to interact with our humanity? And then making that available on Earth. And for me, it's exactly the same theory as science. Discover what is already in existence, God exists. How do we use that knowledge on planet Earth? So I've always seen these as compatible, but I think there's a lot of fear around how faith and medicine can interact. And I think that's been one of the problems we've been trying to address, isn't it, in people's practice?
But also I think over the years, a lot of Christians see their profession of working in healthcare as entirely separate from their faith. And I did a course years ago run by a Christian organisation in healthcare in the UK. And I was really disappointed because what I discovered was that basically everyone there that was the doctor that I knew were either about to leave medicine to go and be a missionary somewhere because they felt the call of God on their lives and they wanted to go and do their religious side, or they basically were there but saying, I don't bring my God with me into my consultation. Yep. I leave him at the door and I just do medicine. And in truth, I was pretty much the only one there who thought you could do both.
Yes, I've had similar experiences. I remember going to a conference for medical missionaries many years ago, and I was just, surprised that there was a debate about whether medical missionaries should actually preach the Christian gospel to the people they were with, or just solely do the medical work, as if these two had to. And I thought, I'm amazed that this conversation is even happening, but it's quite common out there.
It is.
So I think you've got a lot of Christians who work in the health world who think that they're not allowed to practice their faith effectively there, so they have to check that, and then so they do their work and then they do their Christianity separately, and that's what is a challenge.
I think that's true, and I think there is currently now a real culture of fear, not least of which because there's been a few Christians who've achieved national prominence in the UK for getting in trouble with their governing bodies over praying or talking about their faith.
Yes.
And I think there has been a shockwave through the Christian medical and Christian healthcare world saying, so it's not allowed then. And certainly I've known that people quote some of the governance around this kind of thing at them as a way of shutting down the idea that you can be of faith.
Yes.
I mean, certainly for doctors, the General Medical Council, which is a governing body for the UK doctors, I've heard people quote this, and it is a direct quote from their Good Medical Practice document, which is our sort of Bible of how to do medicine.
Guidelines of how you do it, isn't it?
And they quote this, which is true, which is, you may talk about your own personal beliefs only if patients ask you directly about them. Yes. And that's caused people to put things in their room like little praying hands or posters or something in the hope that the patient might clock that and go, oh, are you a Christian?
Yes.
Could you, and they feel that's the only way they can talk about their faith.
Yeah, and so you've done quite a lot of work on this, and I have as well, of actually trying to help people understand that not only is there a benefit by taking people's spirituality into account for the healthcare, but actually there is a requirement to do so that's even in some of our guidelines on there.
Yeah. So basically, as I said earlier, there's a GMC requirement that is a must. You must include their spirituality. But one of the things that was a revelation to me was when I looked at the GMC guidance on this, it talks about only talking about if a patient asks you directly about it.
Yes.
Everyone treats it as if there's a full stop at the end of that.
Yeah.
And that's it, end of discussion. But actually there's a comma.
Yes.
And there's a very important rest of sentence which says, or they indicate they would welcome such a discussion. And that is key, because that is about informed consent.
Yes.
Because if you open up a form of discussion with them and you say, how would you feel about a discussion about this area? And they indicate they would welcome it, you are completely covered. You are completely safe.
Yes.
And I know you found that.
Yeah, again, throughout all my medical career, I knew that my first responsibility towards my patients was to deliver excellent healthcare. Always, always, always. Number one, I'm not there as an evangelist. I'm not there, to convert them. I'm not there to, preach a Christianity. I am there, hopefully, as a good doctor. And I always was very careful to make sure that was delivered. That was my prime aspiration. But every now and then, there are limitations that medicine doesn't quite fit everything, doesn't manage to fix everything. And so the way I would usually approach this was if I would deliver that and say, look, that's what I can offer you as a doctor. There's other stuff from my personal life that you might find beneficial. Would you welcome a conversation about that? And that way in, people actually they opt in, and then you can take it through stages of the conversation where all the way through people have the ability to stop the conversation. They say yes, no. And that conversation is really in their control, and that's informed consent, because I think that's the principle that we've got to work by, is informed consent. That's a universal principle, and if we have, I think when people haven't got that, that's when they get into difficulty.
And I think some of it is about just understanding the person you're with. So for me, I know that 60% of the population believes in a God, but actually if you look at the statistics, the younger they are, the less likely they are to be of a faith, and the older they are, the more likely. So I will routinely, as part of a consultation now, ask someone, if it's appropriate, do you have any kind of faith or religious beliefs? Now, if they're coming with a sore throat, that may not seem a relevant question and I won't ask it. But if they're talking about anything which is psychological or sort of social problems or whatever, it's a logical, reasonable question to ask. And if someone says no, then there's not much encouragement to take it much further, and it's highly unlikely that I'm going to develop anything further than that. But if most people, 60% of people say, well, I like to think there's some kind of God, or I used to be a Christian, or I used to be involved, or I'm involved in a mosque or whatever, then I will quite often then, like you, take it on to the next level and say, there's something from my own personal life that you might be interested in. Would you be interested in hearing about it? Now, I've found, I don't know about you, but as soon as you offer them the option to hear about something from your personal life, they get curious, because doctors don't often talk about something from their personal life. So they'll almost automatically say, yeah, I'm interested. And then I find that I need to then flag up is going to be a faith-based thing. So I will say, actually, I'm a Christian, and I think there might be something about my faith that may be helpful for you. Yeah. Would you be interested in hearing about that? And again, that's like you said, that it's another level they can say, actually, do you know what? I'm not sure that's me. And then I'll go to the final bit, which is I'm part of a church that routinely prays for healing. We've seen miracles. I think God would be really interested in interacting with you and having good into your life. How would you feel if I prayed for you? And I know you pray with your patients as well.
Yeah, I think I often get a question of how many of your patients do you pray for? And actually, my answer to that is actually I pray for every one of them in a non-direct way, because I want them to benefit from my Christianity and I want my Christianity to be beneficial to them. But that's so broadly speaking, I'm covering my whole working life with my prayer life. But that's a different thing to actually when you're going to go for a direct interaction where you do need, to go down that informed consent process. And I remember probably one of my favourite stories with regard to this was when I was dealing with a gentleman, and he'd come in with a lump on his neck, which was obviously quite suspicious to the medical world. I'm reasonably certain he had a cancerous lump in his neck, and I knew I needed to refer him to hospital, just taking him through the process, obviously not saying this is the diagnosis, but you need more investigations, we need to find out what this is. So we're doing basically an online booking system, and while that was going on, he asked me a question. He said, hello, doc. Because I was a locum GP for quite a length of my medical career, not always in the same place, he asked me a question, where do you normally work? So he asked me a question about my life, and I said, oh, well, actually, working as a doctor is part of my life, but I've got another part of my life, if that would interest you. He said, interest you? And he said, oh yeah, what do you do? I said, well, actually, I go around the world teaching people about Jesus and teaching people about miracles. And he says, oh, well, that's interesting. I said, yeah, would you like to know a bit more? He says, yeah. So he said, have you seen any miracles? So I started to tell him stories of miracles I've seen throughout my life, which is in the medical world and actually just out in the church world. And he said, well, that's fascinating. So you've actually seen some miracles. And I told him stories, and he said, so do you think you could do a miracle for me? Now, this is him inviting, and I said, certainly. And because I'm confident that God is in me, is the God who does miracles. It's not just me, but actually we have a God of miracles, and I need to be confident in that. And I said, would that interest you? And he said, yeah. He said, I'd really welcome that. And then he said, well, what would it look like? I said, well, it's very simple. I'll pray for you. It'll probably take about 10 seconds. And if you don't mind, I'd like, if I could, possibly put my hand on your shoulder, because that's just what the Bible tells us with that laying on of hands. It's non-threatening, and he had the option for that as well. He said, yes, that'd be fine. And so there, without closing my eyes, without going weird, without going into religious mode, just looking at each other up, hand on his shoulder, pray for him, 10 seconds. And then I said, okay, well, let's see what happens, because that's an honest answer. And I gave him his referral to the hospital, because that's me doing the correct medical thing. So that he is getting good medicine, and he got this in addition. And cutting the long story short, 4 months later I was back in that medical practice, and I got the news that when he got to hospital, his lump in his neck had completely disappeared.
Yeah, it's amazing, isn't it?
So he didn't actually need
the treatment,
the medical intervention,
no.
which is a fantastic outcome.
And I think it's important that I've had some funny experiences. I think when you get to the point of asking someone, how do you feel about praying? I've had some people, even Christians, when I've said, how would you feel if I prayed for you? Would that be helpful or would that be weird? And some people have said, actually, that might feel a bit weird. So I say, well, shall I pray for you when you've gone? Oh, yes, that'd be really nice. But I've had one or two when I've said, shall I pray for you? And they say, that'd be lovely. And then they get up and leave the room.
Yes.
Because one of the things I've realized is that we're so used to, in our culture, praying for people and we, and how to do it almost. But the public doesn't know the rules.
No.
They don't know that the official receiving prayer is, that's not what they're expecting. They're more likely to just stare at you. So I've realized that actually you have to be a little bit formulaic. So I will say to them, how would you feel if I prayed for you? And if they say yes, say, how do you feel if I pray for you now while you're here?
Yes, good question.
And then, so they may say that, or then you've got to explain what to do. So I will say, look, a lot of people, when they receive prayer, they might want to have their hands open, like they're getting a gift, and they might want to close their eyes. So they're just, waiting to see what God might do for them. But you don't have to if you want to keep your eyes open. And you do have to get used to praying with your eyes open, don't you?
Yes.
You have to not mind if they're looking at you. And then, like you say, it's very important, this whole thing about whether you don't just reach out and touch someone.
No.
Because that's an invasion.
It is, yeah.
I will say, how would you feel if I put a hand on you? And you talked about putting your hand on the shoulder, but a forearm is also very good, particularly in most consultations, or the arm is near them, near you.
Don't put your hand on the head. Very threatening.
It is, and it
very
messes
odd.
Their hair, but they don't like.
They don't like it. It's odd.
But I have my own personal rule, which is if they're younger than me, and if they're definitely a different sex to me, I will not touch them.
No, that's
unwise.
Very wise.
And then, again, they don't know what's going to happen. So I'll say, like you said, it won't take very long. I mean, generally you and I have got 10 minutes to have a consultation with the patient. So this is an adjunct to what we're doing anyway. So I'll say it'll be very brief. And then I'll say, you'll know I'm done because I say amen. Because people don't know when prayer's finished either.
No, they don't.
So basically I'll do that with them. And one of the things that I have changed personally in my practice now, I'm a senior praiser for NHS England, and I'm also on the governing body of a CCG. So I have a degree of prominence.
Tell us what CCG is, just for those who don't understand it.
The CCG is what commissions healthcare for the local population.
Yeah.
So basically, it has the money to spend for hospitals and general practice services. So there's a degree to which I am fairly well known in my area, and so NHS England, who run the governance of the NHS, know about me, and so one of the senior people wanted me to talk through this process.
Yes.
And I have done that. So I've talked with senior people in NHS England about how I do this. And also I've been asked to directly talk about it in my own appraisal.
Yeah.
So this has been vetted.
And how did it go for you?
Well, it was amazing actually. I spent nearly an hour talking with my appraiser about the healing centre, about how I do it, and he was very interested and basically was talking about how he felt he couldn't have an intellectual and a heart sort of approach to spirituality and medicine. So he was quite interested in the whole thing, which is very positive. But one of the things I did in preparation for that is when I do one of these things, when I pray for a patient, it's a procedure.
Yes.
So like joint injections, like having a smear, it's a procedure. And so I code it in the records. I don't hide it.
So you keep a record.
I keep a record of it, and it's coded in the patient record. So this year I knew I was going to be asked about talking about how I pray for patients at my appraisal.
Yes.
So I sent out a feedback questionnaire to all the patients I had prayed for, because I could search off the records. And I looked at all the feedback that I got. And in the time I had 16 responses. And the vast majority was incredibly encouraging, as you found with patients. They're very open and pleased with it. But actually, I had 2 patients who clearly were surprised and clearly felt it was a bit of an invasion, something they weren't expecting. Mm-hmm. Now, I approached them exactly the way we talked about. They'd said yes, they consented all the way, and there was no indication at the time of the consultation or afterwards, there's no formal complaints or anything.
No, just a little bit awkward maybe.
Yeah, but when they filled in the feedback questionnaire, they made it clear they weren't so happy. So now what I've started to do is I've devised a consent form. And so one of the steps I now do is that when it got to the point where someone says, would you like to have prayer? And they say yes, I will now give them a form to read.
Yeah, that's very good.
And it makes clear that if they say no, it doesn't affect their patient relationship with me, it doesn't affect their healthcare, and I'll get them to sign it. So I can put that in the records.
So you adjusted according to your feedback?
I have.
Which is good medical practice, isn't it? Because medical practice is always developing, and medical practice that stands still will soon be out of date. So
exactly. Yeah.
And I think it's really important for people to understand that as Christians we are regularly evaluating our performance, and actually if we can adjust it to make it improve. Because it's worth saying, isn't it, that actually, most doctors, when they have interactions with patients and the patients consent to, actually a lot of them aren't necessarily always happy with the outcome. So it's not specific to prayer. So but it is important that we adjust to the feedback, isn't it?
It is, yeah. I mean, so I think 90% of my patients were highly positive. Now, a 90% success rate on a procedure is really quite good.
It's very good.
But you want to try and eradicate the 10% that weren't happy.
Yeah, so I think that's excellent practice, and that whole wisdom, and that takes us back to the idea that God's given us a spirit of love, power, and the sound mind. And this bit about wisdom and the sound mind in practice is one of the keys to heaven in healthcare, isn't it?
Yeah,
because if we're not wise in the way we try and deliver it, then we will become, I don't know what you call it, a nuisance or unwanted, excluded. So the ability to actually learn how to practice our Christianity wisely in the workplace is one of the keys.
Yeah.
And I think, again, we've looked at other people who've got into difficulties, haven't we? Christians who have, it's worth saying that some Christians have got into difficulty with this. And without making it absolutely universal, but I think our reading of the narratives of those stories would say, probably some unwise practice entered into that, which actually gave cause for the question and complaints.
And even I've noticed over the years that, even if you're a Christian as a healthcare professional and you're talking to a Christian, you can't make an assumption they're going to want you to approach them in a religious way. And certainly once or twice I've had my own patients come back highly upset that a specialist they've gone to see had launched in and prayed for them. And I know that the GMC guidance about this is clear in the UK, but there are code of ethics that the AMA have for the US, and there'll be governance things for Europe. And basically it'll always be the same sort of thing. And there's a really good passage which I came across and love, which is 1 Peter 3:15, which is always be prepared to have an answer for those that ask you about the hope you have. But the key thing is do this with gentleness and respect. Yeah. And actually, when you launch in and pray for someone and they don't want it, what happened to gentleness and respect?
No, I think respecting the person and their belief systems, and that goes it's of all faiths, isn't it? So again, it's worth saying that actually we're offering our Christian resources, if we can put it that way, to people of all faiths. We're not exclusive in any way, but we're not trying to push our Christianity onto people. I think this is a really important concept, is we're offering a resource rather than pushing our religion, and that's a really important philosophy for us, isn't it? And that heaven in healthcare is a resource within the beings of Christians that is there to be offered, not something to be trying to pull people towards a Christian religion, so to speak. Exactly.
And you talked about an amazing story of healing. I mean, my first ever miracle was with a patient, and it was an ingrowing toenail. And I was very upset with God about that. I thought, blindness, yes. Raising from the dead, yes. Ingrowing toenail, not quite.
Not quite
what you'd expect.
Spectacular, really.
No, but what was amazing was I wasn't even thinking of praying for this patient, and they said to me, "Is there nothing else you can do?" A bit like with your guy, and I said, "Well, actually, I could pray for you." Because they'd gone through all sorts of trouble, nothing was helping them. They were really upset with it all, and basically, so I just prayed this quick prayer. And I think that what you said is really, really vital. in church, you've got the worship band,
Yeah.
and you're with your team, and you're in the zone, you know. And when you're in a hospital or in your surgery, there's none of that. You can't get yourself to, right, just hold on a minute. I'm just gonna get the spirit in me and get warmed up. You know, basically you've just been chatting about something and then you just got to launch in.
Yes. No warm-up act.
No warm-up act. And so I just basically prayed this prayer and then got about my day like you did. And she came back 2 weeks later and said, "Are you a healer?" And I said, "Why?" He said, "My toe is completely better."
Ah, fantastic. Okay.
Yeah, and I was able to say, "Well, I'm not, but I know a Jesus who can."
Yeah.
So I think, you know, it can be just really innocuous problems that we deal with. Doesn't have to be, oh, it's cancer, so now I'm going to bring in the healing thing.
But for that, you know, an ingrained toenail can be massively impacting upon somebody's life. Yeah. And so we learn to rejoice over every healing, every interaction, because that's about valuing the person who's in front of us, not just the more spectacular.
Exactly, yeah. And I think it may seem a bit formulaic, this idea of, you know, have you any kind of faith, and would you like something from my personal life? Would you, I'm a Christian, would you be interested in hearing about something about the faith? I know it sounds a bit formulaic, but it's really important that if you do that, you're likely not to run into this problem, because people can say no. And you need to just be able to say, fine, it's not a problem.
Yeah. And I'd say in all my years of medical practice, you know, since 1982, I've never had a complaint about any spiritual interactions. And so that's a good record, I think, a track record.
Yeah. And I'm the same. I prayed for hundreds of patients. And there was a time when I was actually counting.
Yes.
So I actually recorded them all. And I've prayed for hundreds of patients, and I too have never had a formal complaint. Even if they, you know, because what I found is, even if they don't get a healing, even if they don't sort of come back and say, that thing you prayed for has gone, the one thing I've always noticed is whenever I pray, before, you know, when I finish praying, even though time is tight, I'll just roll back in my chair and I'll just wait a moment and see. And nearly always, even with people who say they've got no faith whatsoever, if they've been consented to prayer, I found they just stay in a moment, and God is doing something with them. And sometimes they'll be quietly crying.
I think people feel cared for.
Yeah.
If you do it well, people feel cared for, respected. And I think the other side of things we just say is obviously we can talk about miracles, that's great, but the other side of things is that ability to be loving and kind, like you said, is really important, that people need to feel like they've been cared for in that process, not been targeted with anything, and that we bring that resource, you know, love and compassion with us as well, and I'd say again, joy and peace, you know, that ability to actually have an interaction with somebody. And we have to deal with people in very serious moments of life, and it's not that we don't take it seriously, but be able to do it in a way that actually creates hope, doesn't extinguish joy, and enables them to experience peace is very powerful. And you know, how many people, when they're coming to the doctor, they have a degree of anxiety about something, which is very significant. And I was taught this when I was training to be a GP, that basically anybody who's coming through that door has an anxiety that they're about to express towards you, probably, you know, a few exceptions. But if we can deal with that in a peaceful way, where they go out feeling more peaceful, that is a fantastic success as well, isn't it?
It is, yeah.
And we have the Prince of Peace living within us, and we have a peace that passes all understanding to offer to people. And I think that's a very powerful offering as well.
It is. And I think one of the other things that helps, I mean, I'm very lucky because I practice only 15 minutes away from the church, but I would encourage people to try and have links with a local church. I mean, you know, because one of the things you may find is that some people, patients you interact with, may not want personal prayer, but they might be interested in an extra somewhere else to go.
External.
And if you feel a little bit uncertain about whether it's appropriate to pray for someone, you know, if you can refer them. This is partly why we're so desperate to get the Healing Centre as a recognised centre. So I have cards for the Healing Centre in my surgery, and so if I feel uncertain about whether to pray for someone, or even if I pray for someone, I can say, why don't you try these people? I trust them. I know who they are, and they can go. In fact, I had one of my patients, and I'll talk to them and say, you know, why don't you try coming to get involved with the church if you found this helpful? And one of the great stories I had was one of my patients gave me consent for this story. she always found she loved it when I prayed, always found that peace you were talking about. So I invited her to go to Eastgate, and I saw her one day in Eastgate and said, "Oh, you're here?" I said, "Oh, it's fantastic, so peaceful." And then after a couple of weeks, I saw her again, and she said, "Yeah, my husband made me come." He said, neither of us are Christians, but he said, "You've got to go to that church. You always come back different when you've been to Eastgate." And she started to do that. And then Eastgate ran a course, a sort of basic introduction to Jesus course. She did that course. And then ultimately, after a few months, I got texted a picture by a friend, and it was my patient getting baptized.
Oh, fantastic.
And that was all from just taking that initial step of saying, how would you feel about learning something about my personal life? Led to her becoming a Christian.
So that can be an ultimate outcome, can't it? That somebody decides that they want to know more about Jesus for themselves.
Yeah.
Which is fantastic.
But if they just come back like your guy and say, I mean, you remember the guy you talked about that came with the pain in his side?
Oh, very funny, yeah. Well, it wasn't funny at the time. This guy was very seriously ill. And I was in the middle of one of those really hectic, surgeries, clinical sessions. So hectic then. I was way behind time, and there were lots of emergencies waiting for me. And this guy came in, and you're just desperate to have something that's simple to solve. Something coming in through the door that you say, "Oh right, okay." But this guy came in, and he was grey. You can see when somebody's ill, obviously ill. This guy was obviously very ill, and I had to discover what was wrong with him quickly, because I had all this waiting room of people waiting. But I was certain I'd have to send him to hospital. But just looking at him and the way he described his pain and everything. Well, what was remarkable was actually, and I was just doing what was necessary medically, and during the consultation, all his symptoms disappeared. And it was he was surprised. I was very surprised, and he said, and then he started to apologise to me,
because didn't he say, "I can't do this seat," and then he discovered he could do it?
Well, he was in agony, and I asked him to do something. He said, "Oh, that really hurts, Doc." And I said, "Well, I'm trying to find out what's wrong with you. Could you just help me?" And then he suddenly realised that he could do these things, and the pain had just disappeared. And he was surprised. Now, I was surprised. No, you think, well, great man of faith, you should expect all this. But I was in the middle of this really hectic session, just trying to get my way through. And all of a sudden, it seemed there was an intervention of God that came from left field. There was no direct spiritual intervention, but this is actually the power of God that's at work within us. And like I said previously, I cover all of my work with my prayer life, and God turned up and did something. Now, again, with him, I did all the medical things. So if the pain comes back, this is what you need to do, and then we'll check up on you, and no problem with follow-up. But he literally left that consulting room a completely different colour, feeling completely well, astonished and happy.
Yes.
And I was pretty happy as well.
I mean, it's amazing, isn't it? I find some of my best interactions with patients spiritually are when I'm running late or under stress.
Yeah.
It's almost like God gives you a choice. So now what are you going to do? And one of my things that I've realised is also you've got to be open. If you get to this point where you're thinking about bringing spirituality in, you need to be open to what God wants to say to you for them.
Yeah.
And that can be difficult when you think about medicine and what to do right and how to do it. I had one patient who gave me consent to talk about this story where she wanted prayer and she had huge psychological problems, major social issues. She was had a very sad life and was very upset. And normally I will just pray a blessing type prayer over them or healing, and straight into my mind a picture of a white horse came.
Oh yes, I remember.
And I waited a moment just to think, okay, well, what's that about, God? What do you want to tell me about this? And nothing more came. And obviously, she's sort of in prayer mode, so I can't spend a minute going off to think about God and what is going on about. So all in the end I said was, does a white horse mean anything to you? I said, does a horse mean anything to you? And she said, what colour?
Yeah.
And as soon as she said what colour, I thought, here I go, I'm on something now. And I said, it was a white horse. Does a white horse mean anything to you? And she looked at me and she welled up and she said, that's my only happy memory.
Wow.
She said, I was crossing a field and this horse came up to me, a white horse came up to me and nuzzled me. And I spent this time stroking this horse's neck, and it was nuzzling me. It's my only happy memory.
From her life?
From her life.
Wow.
And I was able to share with her that that God brought that moment to my mind because he wanted to show her that he cared for her. He knew her.
Yeah.
He knew her so intimately. He knew that happy moment. And he loved her. And basically I could just briefly talk to her about the love of God.
He wanted to intervene in her life.
He wanted to intervene in her life. So, we just need to be open to these things. Very quick little thoughts that God can drop into us.
And this is one of our great desires, isn't it, through Heaven in Healthcare, is to help people know how they can this is normal. This is normal Christianity.
Yeah.
How can you do this? So it's not just a few of us, so-called seeming specialists who do this, but every Christian who works in the realm of healthcare can deliver these resources. And it can be from somebody, cleaner, porter, receptionist, consultant, surgeon, nurse, physiotherapy. Any Christian working in that realm has the same Holy Spirit inside them, and through their interactions with the people in those settings, they can actually deliver heaven on earth.
Yeah. And I think it's important. I suppose you and I have been doing this for a long time, and it, probably the threshold for doing this seems low now. We're not quite so worried about doing it, but in the early stages of doing it feels very nervous, doesn't it? You can feel very nerve-wracking, change in the consultation to involve this kind of thing.
And that's where just learning from others who've gone before, wise practice is really learning and keeping on developing and finding your own ways of having conversations that's natural for you. Because I think that's really important, because you and I do it, same concept, but slightly different ways. And I think that's really important, that you are who you are.
Yes.
And your patients want to interact with you, not a formula that you've picked up from somewhere else.
There's no rigid formula. But I think ultimately there is a step of faith you need to take. And I remember vividly, I was in a conversation with a senior GP in a locality, and they were in a lot of pain with their back. They were in agony every 5 minutes. I didn't need to be that good a doctor, because basically stood up, wandered around. They were clearly in pain, and I was there for a meeting. It wasn't, it was a formal professional meeting, and I felt God say to me, pray for her, offer to pray for her, and I really did not want to do it. Because I thought, this woman is very senior. She could make my life a misery.
Could get in trouble here.
I could get in trouble. And I really did, and I spent 5 minutes having that debate with God. The kind of thing where you no, I don't want to do it. Yes, do it.
Yes.
And in the end, I just thought, okay, I have a choice. Either do this or don't do this. And so I did the things that we talked about doing. And I prayed for her, and the pain went. And she just looked at me in total astonishment. And we got on with our meeting. Yeah. But what was interesting was, about a month later, the pain came back, and she contacted me and said, can you pray for me again?
Wow.
And in the end, we started to meet, started to talk, and in the end, I managed to lead her to Christ. And I had that wonderful privilege. But I remember that moment, and I do counter it every now and then, where you feel God say, talk about this. And my spirit was going, I don't want to, and there is a moment where you have to cross that Rubicon.
Yeah. Brilliant. The principle of informed consent is one that runs throughout the whole of health provision, it's not just doctors, obviously, but anybody who's offering an intervention. That principle would be universally applied, wouldn't it? And not just in the UK, but right across the world, as far as we're aware.
That's very true, and obviously our world is doctor world, but I have looked at other guidance as well. I mean, the nursing guidance is very similar, to be honest. It basically talks about who initiated the interaction, and obviously if the patient initiates it, you're on a lot stronger ground. If you initiate it, you need to be just conscious that means you need to be very careful about what you do. And what they ask, has consent been given? Yeah. So they're very interested in consent. Does it comply with your professional codes of conduct? And most interestingly, what they say, because they've realised that a lot of nurses are going to be salaried, they're working for an employer. Does it comply with your employer's code of practice?
Yes.
And I think this is really key in terms of, you and I have the luxury of being, as GPs, being self-employed. We work for ourselves, but most people work for someone else. And obviously, we know of a colleague who's really pioneering healing and praying for healing. And I know she's going to appear in some of the other episodes, Sasha.
Yes.
I had a conversation with her about how she was going to do this with in the context of being employed.
Yes. We got another one, a lady who works as a physiotherapist, and so she's actually now working with her governing authorities of how Christians can actually practice their Christianity in the workplace, and they're actually asking her to help formulate the good practice guidelines for that. And I think we have got to be aware, that people have employment contracts which they need to respect. And
they need to read them.
They need to be aware of them, and they need to respect them. And then they also, if you're trying to take any initiative, you need to talk it through with effectively the governing authorities, the people who have that responsibility over you in that workplace. And that's really important, because that's a whole respect issue as well. We're not there to be subversive.
No.
We are there to be working within the system to enhance the system, and sometimes to ask questions about the system. So I remember actually Sasha, who he's going to come into this series later on. She works at a minor injuries unit, and she said actually she went to her manager and said, look, when people come to benefit from the service, they fill out a form which actually asks them if they have a religion, and we asked them to tick the box. And then Sasha said, so do we do anything with that information, or is it just irrelevant information, or do we believe that's important to people? They said, oh, that's a very good point. We tend to ignore that. She said, well, would it be beneficial if I looked at that for you and actually worked out how we can use that information for the person's benefit if religious belief is important to them? Because at the moment we ignore it. So I think what Sasha did was she went to her bosses and said, look, this is actually here, but
we're not doing about it.
Effectively, we ignore it. So
and Sasha and I talked, and one of the things she realised is she needed to go to a manager and say, look, I'm going to start doing this thing. Like I did when I first started years ago, I had non-Christian partners in the practice I was working with. I needed to sit down with them and say, look, I'm going to start doing this. You're going to start seeing entries in the records. And I really encouraged Sasha that she needs to make it upfront. Like we talked about not being sort of, under the radar or some sort of closet thing. And there is for those who know about coding, there is a read code, or now SNOMED code, laying on of hands with prayer.
Yes.
And I encouraged her to have a look, and lo and behold, that code was in her matrix of things she could code on her records. And so she talked to a manager and said, look, how would you feel if I did this interaction with patients, explain how she was going to do it, and document the fact she'd done it in the records. And we really encourage people to have those conversations. And when people have run into trouble, it's when they have given assurances or been told to not do something and have gone against it. And certainly there was a nurse that ran into national prominence because she was sacked from, in fact, a local hospital to us because she prayed with patients. There were some complaints. She went to a disciplinary procedure and she made an agreement with the managers that she wasn't going to do it. And then she promptly broke that agreement. And that's what got her into trouble.
Yes.
Because she said she was going to do something and she didn't keep to it. And ultimately, we need to respect the people we're working with and for. And if there's a reason why they say, don't wear that cross or don't pray, you can try and work around it and talk about equality laws and use equality laws to say, I have an equal right as someone else to have my faith respected. But ultimately, if you've given an instruction not to do something, you do need to respect it.
That was a great big story. Fortunately, that lady's been restored back
into
the workplace now, because she actually followed the procedure of effectively a disciplinary procedure, and she's gone along with it, and now she's been restored.
Yes,
which is great. A great outcome for all concerned, I think. So.
Yeah. I think it's also important to remember that I know we've talked about UK guidance, but the AMA, the American Medical Association, has a code of ethics, and they talk about what to do about praying with patients, that kind of thing. And there will be guidance in Europe. I don't think we need to get too bogged down in what specific wording is, but I've quoted some because it's helpful, I think, for our UK audience. But the things we've talked about, the ethics of informed consent and respect, will be universal, won't they?
Yeah, they are. And I think whatever country, and you have to be aware of the guidelines. And I know actually some countries in Europe are more restrictive about praying for patients. So you just have to be aware of that. And then I love the bit in the Bible which says, if you lack wisdom, ask for it, and God will give it to you generously and without finding fault. And everybody's going to need to find the wisdom of how this will work in their own context. And that's obviously, we've worked out how to do it in the UK. We're trying to work out. But ultimately, our confidence is that God has a an unending supply of wisdom which he can offer to us.
And also use your friends and colleagues. I mean, you know, I helped Sashi talk about what she was going to say to a manager, and that physio mentioned I helped write the protocol that she wanted to give to managers. And whenever I do something like the feedback, the consent form and the feedback questionnaire, you and I worked on that together.
Yes.
And the consent form, I've run it through you and some other people I trust. You know, don't just think you have to do it alone.
No, and that's one of the beauties of Heaven in Healthcare, because we're trying to create a community where people can find others and actually can think with others, you know, and work this out together. And again, for us, that's one of the beauties of Heaven in Healthcare, is this emerging community which has got an online presence and local groups, and hopefully that will continue to grow and grow, so that more and more people are benefiting from resources on offer.